Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Hello there, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips so you can thrive in nursing school and even beyond that at the bedside. So today, this episode probably is more geared toward a student who has to take an exam or an NCLEX and be able to differentiate between the different types of viral hepatitis. So I'm going to be breaking it down for the key things to know and hopefully providing a quick little memory aid that will help you remember these when it comes time to take those exams. Before we hop into that, let's take a quick minute for a listener shout out. And this one goes out to Mikhailo, who says, I look back to September of 2023 when I was applying to nursing schools while working as a UPS driver. This was the perfect time for me to discover the Straight A Nursing Podcast. Since then, I've listened to all the episodes, some of them twice or even 3 times. Fast forward, I am preparing for my first exam for nursing fundamentals in my ABSN program. As I go through my classes, I find myself being knowledgeable and aware about most of the information. I acquired the Nursing School Thrive Guide book that was extremely helpful in preparing for the program, and I'm also definitely purchasing Study Sesh so I can listen to the familiar voice while doing meal prep and exercising. Thank you, Nurse Mo, for being there for us. Well, thank you, Mikhailo. I love this story. I love that you were out there hardworking and finding a way to incorporate listening to the podcast and preparing for nursing school. And now you're feeling so much more prepared and ready for an accelerated program, which is absolutely no joke. So thank you so very much for sharing your experience with the podcast and the book. And I hope that you got Study Sesh and that it helped you a lot too. Alrighty, let's dive into this episode looking at viral hepatitis. So hepatitis is a condition in which the liver is inflamed. Remember, itis means inflammation and hep is related to liver, so liver inflammation. This inflammation can occur for a variety of reasons, and in some cases, the inflammation is acute and the patient has a full recovery. In other cases, hepatitis can become chronic and even lead to advanced and very serious liver disease. So I mentioned a moment ago that this inflammation of hepatitis can occur for a variety of reasons. And when we think of hepatitis, we generally tend to think of it as caused by a virus, which includes hepatitis A, B, C, D, and E. These are the 5 different types of viral hepatitis. Each type is, of course, caused by a different virus, and how it's transmitted varies. And that's one of those things that you have to remember for your exams. So in this episode, we're going to look at the different types of viral hepatitis, as well as some general information about hepatitis, general signs and symptoms, and some key patient education. But first, let's start with looking at functions of the liver and then very, very basic hepatitis pathophysiology. So you may remember from anatomy and physiology class that the liver has a whole lot of functions, and that's the key reason why liver disease and especially liver failure can have such widespread effects in your body. I'm telling you, your patient with liver failure, if you're working, for example, in an ICU, will be incredibly, incredibly complex. So these liver functions include bile production. So remember, bile aids in the digestion and absorption of fats or lipids. Then there's drug metabolism. Many, many drugs are metabolized in the liver. There's also the storage of fat-soluble vitamins and some minerals, such as copper and iron. There's also the metabolism of bilirubin. So remember, the breakdown of heme produces bilirubin, which is metabolized by the liver. So when the liver isn't working, the bilirubin builds up and it accounts for some of those symptoms. The liver also is involved in the synthesis of plasma proteins, including albumin and clotting factors. And it also has a role in the conversion of T4 to T3. Recall that T3 is that active form of thyroid hormone. So we got a lot of things going on in the liver, a lot of associations with other body systems. So you can imagine that a patient whose liver isn't functioning is going to be very, very sick. So very basic pathophysiology is that the hepatitis virus infects hepatocytes, causing inflammation and swelling of the liver. And this swelling interferes with liver function, causing the patient to experience symptoms like nausea, jaundice, or joint pain. There's a lot others. We'll talk about them in just a moment. As the disease progresses, the organ hardens, which is called fibrosis, and undergoes scarring, and that's called cirrhosis. And both of these drastically affect the liver's ability to function properly. And eventually, the organ can no longer meet the body's demands, and now we have liver failure. So now let's look at some signs and symptoms of hepatitis. And in a lot of cases, these signs and symptoms of hepatitis are associated with the signs and symptoms of liver damage, such as in cirrhosis, because hepatitis can certainly lead to cirrhosis. Many cases of hepatitis are actually mild, and a lot of patients may have no symptoms at all, or simply show maybe signs of an infection like a fever or fatigue and have no idea that they have hepatitis. But again, they can also have more prominent symptoms, especially if the liver is really damaged and suffering while we're undergoing this attack from these viruses. And then obviously advanced liver disease is going to cause more prominent symptoms as well. So a general sign of infection is a fever. And like I said, many patients may have no symptoms. They may just have a fever and be uncomfortable, maybe have some pain, some joint pain or generalized pain. And then there's fatigue. Fatigue occurs as the body is working really hard to fight off this virus. Another symptom is nausea and vomiting. So nausea and vomiting occur as the liver's ability to remove toxins from the body decreases, and this leads to GI upset. There's also abdominal pain. Liver inflammation can cause abdominal pain, as can ascites and an enlarged spleen, which occur as the disease progresses. Another symptom that a patient may have is loss of appetite. So loss of appetite can occur due to that GI upset. I don't know about you, but when I'm nauseous, I don't want to eat. And it's also because of abnormal levels of ghrelin and leptin, which become abnormal in liver disease. And if you remember, those are the hunger hormones. The patient will also have dark urine, and dark urine occurs due to the buildup of bilirubin. And then the stools are often clay-colored or light-colored stools. So if you see stools that are really light-colored, kind of grayish, kind of clay-colored, this is abnormal and is strongly associated with liver disease. And it's because the liver is not producing or draining bile adequately. And then what about skin signs? There's jaundice, which is that yellowish discoloration of the skin, and the sclera, which is due to the buildup of bilirubin in the system. The patient may also have generalized pain or may complain of joint pain. This is because inflammatory cytokines associated with liver disease also cause this generalized pain and joint pain. And then bruising. Individuals with liver disease bruise easily due to the reduced production of clotting factors by the liver. And then you may notice edema in the legs. Edema occurs due to third spacing of fluids. And this occurs because the patient has low albumin levels. Remember, the liver produces those plasma proteins, and one of those is albumin. And when albumin is low, then that decreases oncotic pressure and fluid can leak out of the vascular space. So it leaks out into the legs, and we have edema. This fluid shift can also occur in the abdomen, and that is a condition called ascites. And this occurs due to portal hypertension and the combination of that with decreased oncotic pressure secondary to low albumin levels. So that fluid leaks out, it leaks into the abdomen, and the abdomen becomes enlarged. It puts pressure on the diaphragm, and the patient can't take deep breaths. They may take very shallow, fast breaths. And so not only is it very uncomfortable just because the abdomen is so enlarged, it can also lead to respiratory compromise. And then another one is cognitive changes. Liver disease can cause ammonia levels to build up, and ammonia is very toxic to the brain. This leads to confusion and something called hepatic encephalopathy. So those are some things that you might see in a patient with hepatitis, ranging from mild symptoms like fever and fatigue, maybe a little nausea, all the way up to bruising and ascites and cognitive changes. But again, some patients with hepatitis don't have symptoms, which is problematic because if they don't know they have hepatitis, then transmission gets a whole lot easier. And then one more key thing to know is which labs are going to be abnormal. I'm not going to go through all of them because as you just learned or were reminded that liver disease, liver dysfunction really does affect a lot of the body systems. I'm just going to talk about the liver function tests here because a patient with severe liver disease could have abnormal labs all over the place. I want to keep this really focused on the liver itself. So in addition to testing for specific antigens and antibodies when diagnosing hepatitis, LFTs or liver function tests will be elevated as well. And how much they're elevated will correlate with the extent of liver damage and how much that virus is affecting the liver. So the key labs to evaluate are the AST, the ALT, alkaline phosphatase, and bilirubin. So again, that was AST, ALT, alkaline phosphatase, and bilirubin. Okay, now let's dive into a quick overview of each type of viral hepatitis, and then hopefully a little memory aid to help you remember the key thing about each one. So we'll start with hepatitis A. So hepatitis A is a form of acute hepatitis that primarily occurs when someone ingests the hepatitis A virus. This can occur from ingesting contaminated food or water, as well as through the fecal-oral route, which is a very common route of transmission for hepatitis A. For example, if someone with hepatitis A doesn't wash their hands thoroughly after going to the bathroom, and then they come out of the bathroom, you're having a business meeting, and they shake your hand, you could contract hepatitis A if your hand or that sandwich you pick up to eat with your hand gets into your mouth and into your body. Hepatitis A can also be spread through close personal contact, including sexual activity, and when sharing needles with an infected individual. Hepatitis A is highly contagious and accounts for about 20 to 25% of hepatitis cases in developed countries. The good news is hepatitis A can be prevented with a vaccine, and most cases resolve in about 2 months without causing long-term illness. So your memory aid for this is A stands for anus, because most cases of hepatitis A are spread through the fecal-oral route. Okay? Got that one? Hepatitis A, fecal-oral route. Next up is hepatitis B. So hepatitis B can be acute or chronic. Remember, acute means it doesn't last very long, it goes away. Chronic means it continues and persists. So it can be acute or chronic and is spread through contact with infected body fluids such as blood, saliva, vaginal fluids, and semen. The acute form usually occurs within 3 to 5 months of exposure to the virus, the hepatitis B virus or HBV, and severity can vary widely. Some individuals have no symptoms or very mild symptoms, while others will have severe illness requiring hospitalization. When an individual is unable to recover from acute hepatitis B, they develop chronic hepatitis B, which can cause serious liver disease, such as cirrhosis and even liver cancer. So hepatitis B is a global health problem, with the highest incidence of cases in the World Health Organization Western Pacific region, which includes China, Mongolia, Vietnam, Malaysia, Japan, New Zealand, Australia, and also in the World Health Organization African region. So if you have patients coming from these areas showing signs of liver dysfunction, you might clue your suspicion into thinking, oh, I wonder if they have hepatitis B. We should probably test them for that. So your memory aid for hepatitis B is for body fluids. And hepatitis B is spread through infected body fluids, including blood. Next up is hepatitis C. Hepatitis C is caused by a blood-borne virus that is transmitted through exposure to infected blood. This can occur due to sharing needles. It can occur due to a needle stick injury in the healthcare setting. It can occur due to unscreened blood transfusions and sexual activity as well. In about 30% of individuals, the virus causes acute asymptomatic illness that typically resolves within about 6 months. Other cases of hepatitis C virus or HCV infection cause chronic illness that can also, just like hepatitis B, lead to liver cirrhosis and liver cancer. Now, unlike hepatitis A and hepatitis B, there is no vaccine for hepatitis C, but there is treatment available, and that's going to be antiviral medications that are tailored to the specific strain of the HCV or the hepatitis C virus. Hepatitis C is a leading cause of liver failure and liver transplant in the United States. So your memory aid is this. C stands for CBC. So when you think CBC, I want you to think blood, because hepatitis C is spread via blood exposure. All right, now let's talk about hepatitis D. Hepatitis D is known as an incomplete virus because it can only infect individuals who are already infected with hepatitis B. Like the other forms of hepatitis, infection with hepatitis D virus or HDV can be acute or chronic. A key difference is that the acute form causes more severe symptoms than other types of viral hepatitis. An individual who progresses to the chronic form of hepatitis D will have more severe and rapid disease progression than someone who just has hepatitis B. And when you think about it, that makes sense, right? They basically have 2 types of viral hepatitis, so they're going to be more sick. The treatment for HDV in most countries is pegylated interferon Though it's not super effective, the study I found said it was only effective in about 30% of cases. And there is no specific vaccine against hepatitis D, so the only way to prevent it is to get a vaccine against hepatitis B and just don't get hepatitis B. Your memory aid for hepatitis D is that D stands for double because it must also occur along with hepatitis B, so you have double hepatitis infections. Our last one is hepatitis E, and this is the most uncommon type of viral hepatitis in developed countries, and in most people only causes mild illness that resolves on its own. The HEV virus is usually spread by the fecal-oral route, and in developing countries, the most common source is contaminated drinking water. Other sources that have been identified include undercooked pork and shellfish. For that reason, you may also see it referred to as a foodborne illness. There is no specific treatment for HEV, nor is there a vaccine available in the United States, though in 2012, China approved a vaccine for use in that country. Your memory aid for hepatitis E is that E stands for easy because hepatitis E generally only causes mild illness that resolves on its own. So that is your overview of the different types of hepatitis. I next want to go and do a little pod quizzing with you to just solidify your understanding. Before we dive into the pod quiz, let's take a quick minute for a break, and then we'll come back and see how much you remember about hepatitis.
Hello, listeners. This is Anne Bogle, author, blogger, and creator of the podcast, What Should I Read Next? Since 2016, I've been helping readers bring more joy and delight into their reading lives. Every week, I talk all things books and reading with a guest and guide them in discovering their next read. They share 3 books they love, 1 book they don't, and what they've been reading lately. And I recommend 3 titles they may enjoy reading next. Guests have said our conversations are like therapy, troubleshooting issues that have plagued their reading lives for years, and possibly the rest of their lives as well. And of course, recommending books that meet the moment, whether they are looking for deep introspection to spur or encourage a life change, or a frothy page-turner to help them escape the stresses of work, school, everything. You'll learn something about yourself as a reader, and you'll definitely walk away confident to choose your next read with a whole list of new books and authors to try. So join us each Tuesday for What Should I Read Next? Subscribe now wherever you're listening to this podcast, and visit our website, whatshouldireadnextpodcast.com, to find out more.
So if you have not done a pod quiz with me, welcome to your new favorite way to study on the go. I'm going to ask a question and then pause for a little bit and give you time to think the answer or say the answer. And it's okay if people look at you funny because you're studying and you're going to be an awesome nurse. And then I'll tell you the answer, okay? I always say it's like doing flashcards with your ears. So you ready? Let's get started. So, what was the memory aid for hepatitis A and what did it stand for? So, A was for anus, and that was because hepatitis A is spread through the fecal-oral route. Excellent. What about your memory aid for hepatitis B? That was body fluids. B is for body fluids, and that's because hepatitis B is spread through infected body fluids, including blood. What's your memory aid for hepatitis C? So C stands for CBC, and hepatitis C is spread via blood exposure. So when I think of a CBC, I think of a complete blood count. I'm thinking blood. All right, how about hepatitis D? What was your memory aid for that? D stands for double. And what did that indicate? That's because it can only occur along with hepatitis B. And then hepatitis E, what was your memory aid for that one? E stands for easy because hepatitis E generally only causes mild illness that resolves on its own. All right, let's do a few more questions. What two types of hepatitis have a vaccine available? That is hepatitis A and hepatitis B. Very good. Which type of hepatitis occurs along with hepatitis B? That was hepatitis D. Excellent. Which type of viral hepatitis is this? It occurs from exposure to infected blood, can be acute or chronic, and is treated with antiviral medication, but can cause severe liver disease and require liver transplant. Also, there's no vaccine for this type of hepatitis. Which one is that? If you said hepatitis C, you get a gold star. Which type is this? It's mainly transmitted through the fecal-oral route and can also be transmitted through contaminated drinking water, undercooked pork, shellfish, and generally causes mild illness that doesn't require treatment and resolves on its own. There's also no vaccine for this type. That is hepatitis E. Excellent. Which type of hepatitis is this? It's transmitted via contact with infected body fluids such as blood or saliva and can be transmitted from mother to child at birth. It can cause acute or chronic symptoms and does have a vaccine that is administered in 3 doses. That is hepatitis B. And if you're a nursing student in the United States, you probably had to get the hepatitis B vaccine. I know I certainly did in California, and I distinctly remember I had to go in for 3 doses. And that one kind of hurt. I don't usually react to vaccines and get like a sore arm that much, but I do remember the hepatitis B one packing a punch. All right, which type of hepatitis is this? It's mainly transmitted through the fecal-oral route, can also be transmitted through contaminated food or water, and through person-to-person contact. And it is an acute form of hepatitis that does not require treatment and resolves on its own. There's also a vaccine for this, and it's a 2-dose vaccine. Which type of hepatitis? That is hepatitis A. Excellent. All right, so you've reviewed some key things about the viral hepatitis types. Now let's talk about some general key things that you would teach your patient with hepatitis. So one of those is they should get vaccinated against other forms of hepatitis. We don't want to kick them while they're down, right? And get even further liver injury. Speaking of patients who have one type of hepatitis, if your patient has hepatitis B, they should know to get tested for hepatitis D if their condition worsens or if they notice signs of a new infection, such as a fever. Anyone with hepatitis should avoid alcohol as this can be damaging to the liver. Again, we don't want to kick that poor liver while it's down. Let's give it some time and some space and some TLC so that it can recover. With that, we also want to teach our patients to avoid medications that can harm the liver further. And there are a lot of medications that can harm the liver. So some common ones include acetaminophen, NSAIDs, statins, sulfa antibiotics, some anti-seizure medications, and even herbal remedies like black cohosh and kava. Now, you also want to teach your patients with hepatitis A or E that they should wash their hands after any exposure to stool that contains the virus, like after they go to the bathroom, and then wash their hands again before preparing food. If you've got a parent caring for a child or a baby with hepatitis that is transmitted through the fecal-oral route, they must wash their hands after changing diapers and again before preparing food, just to be safe. Several forms of hepatitis can be transmitted through person-to-person contact, including sexual activity, so individuals should take measures to prevent the spread of infection in that way. Teaching patients that it's also important to avoid transmission of blood-borne viruses by definitely not sharing needles. And you also want to teach that anyone with hepatitis should follow a healthy diet that includes a variety of fruits and vegetables and whole grains. They should avoid foods high in salt, sugar, and fat, as well as undercooked foods and raw shellfish. Remember, some of those forms of hepatitis, specifically hepatitis E, could come from undercooked foods. And you always want to wash all foods because some forms of hepatitis are through contaminated water or contaminated food. And sometimes the contaminated water gets on the food and now the food becomes contaminated. So we're just going to wash everything very, very carefully. And also maintaining an optimal body weight is also advised for individuals infected with hepatitis virus. So good job reviewing viral hepatitis. You're absolutely going to crush your exam. You're going to crush your NCLEX. So if you liked the pod quiz specifically, then I would love for you to check out Study Sesh, which is a private podcast that I developed, which is mostly made up of pod quizzes, which I call flashcards for your ears. So if that's a helpful way for you to study or review, then definitely check out Study Sesh. I'll put a link in the episode notes. And I will see you back here next week, where I believe we'll be diving into a pediatric topic. If my plan goes according to plan, then that's what we'll be talking about. So I'll see you then. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
At a time when change is constant and we are pulled in far too many directions, we need a way to stay present to life and to increase our ability to remain calm, think clearly, and maintain our well-being. Many studies indicate mindfulness improves our mental, emotional, and physical health. On A Mindful Moment with Teresa McKee, you can learn how to practice mindfulness and enjoy its many benefits. Tune in for guided meditations and to hear tips and advice from some of the most respected experts in the fields of mental health and mindfulness. The world truly can be a better place. It all starts with a mindful moment.